Hello, today is November 15th, 2020. My name is Ivana Garcia. I'm interviewing Brenda Cortes for the University Library Special Collections and Archives at the University of Texas Rio Grande Valley, hereafter abbreviated as UTRGV. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Ms. Cortes, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with the Voces Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs and other documentation you are willing to share. UTRGV University Library will retain copyright or non-exclusive right to the interview and any other materials you donate to Special Collections and Archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'll ask you a series of 6 questions. Please say, yes, I agree, or no, I do not agree after each question. Question number 1. Do you give University Library and Special Collections and Archives at UTRGV consent to archive your interview and your materials at the UTRGV University Library?
Yes, I agree.
Question number 2. Do you grant UTRGV University Library Special Collections and Archives right, title, and interest in copyright over the interview and any materials you provide?
Yes, I agree.
Question number 3. Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voces of a Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes, I agree.
As you recall, we previously filled out a pre-interview form. We used information from the pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it UTRGV University Library Special Collections and Archives, we would have stripped out any contact information for yourself or family members. So that will not be part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions ask for your consent on what I just described. Question number 5. Do you wish for us to share the rest of your interview in your public file available to researchers at UTRGV University Library Special Collections and Archives?
No, I do not agree.
On occasion, UTRGV Special Collections and Archives and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
No, I do not agree.
Thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you say in the interview questions I will now ask. Brenda, thank you for your time. Your stories and experiences are valuable to us at UTRGV Special Collections and Archives and the Voices project. Particularly for us at UTRGV Special Collections, we are committed to preserving the stories of Mexican Americans and Latinos from South Texas and the Rio Grande Valley, and those who work closely with these populations during this COVID-19 pandemic. Due to your knowledge as a loving spouse, a dedicated employee, and friend about the impacts of COVID-19, I truly appreciate and consider your experiences invaluable in this historic time. So, before I ask you to share stories about your life in this pandemic, tell us, Who is Brenda Cortes?
Hello, I am Brenda Cortes. I'm a financial advisor for a trucking company by trade and a baker for leisure. One of the things that I enjoy the most is traveling and learning about other countries' gastronomy and cultures.
Okay, let's start with some personal questions. Question number one. So, the first question I want to ask you is, when did you first hear about COVID-19? How did you learn about it? Was it through radio, TV, etc.?
The first time I learned about COVID was back in February of 2020 through online news.
What was your first reaction to the information about COVID-19?
At the beginning, I was just a little alarmed, but it definitely never went through my mind that it was an event that would affect the way we live.
Around what point did you realize this pandemic was a serious life-altering event, or do you not think it's serious? Why?
It began to hit me when the news got worse as days went by, but I really felt the wave of trepidation when the numbers of cases started to increase here in the United States and that so many people were being hospitalized. The number of deaths that this virus has brought is just heartbreaking. That for me was the point in which I realized there was no going back to normal.
Over the last few months, what news media, social media, or other sources do you rely on to keep you informed about coronavirus?
I mostly follow CNN News and CDC for guidelines.
Can you share with me what you understand about COVID-19 as an infectious disease? Likewise, can you share with me what you don't understand about this new coronavirus?
What I understand about coronavirus is that this is a type of virus that affects the respiratory system. It can be spread person to person through droplets released into the air when an infected person coughs or sneezes. I understand that there's people that might carry the virus but are asymptomatic, and that makes it even more dangerous. It's hard to track. That is why social distancing is crucial in preventing the spread.
In your opinion, would you take the first COVID-19 vaccine available on the market? Why or why not?
That is a matter that I'm still debating on. I am more inclined towards taking the vaccine to prevent the virus, but it definitely is scary to think that your body will not react well to it.
Does your family hold the same beliefs as you about COVID-19, or are there some members who take it more seriously or lightly?
At the beginning, there were family members who thought that this event was fake, that the media was trying to manipulate it somehow. However, those family members started to realize this was real and serious, that this was a real and serious matter when people close to us start to have symptoms.
For these next set of questions, I'd like to talk about how you've seen COVID-19 affect family members and friends. Did you or anyone in your family contract COVID-19? If yes, around what month of 2020 did this happen?
The first week of July, a coworker tested positive, and I was asked to work from home since I had contact with her. My husband and I immediately tested for the virus since I had contact with my coworker. We both had a negative result. However, we started to develop symptoms mid-July. My symptoms were mild. I only lost the sense of smell and taste for 2 days. My husband's symptoms were mild as well, congestion and loss of smell and taste. However, his symptoms lasted 10 days in total. What is interesting is that my husband did test positive for the virus, and I, on the other hand, always tested negative.
What was your biggest concern once your husband tested positive? What was the first thing that came to mind?
My biggest concern was that the symptoms would get worse and that he would have to get hospitalized. That for me was frightening to think about.
How did this positive test result affect his health and his work life?
I think that it affected him not only physically for the time that he felt sick, but also emotionally because he was afraid. It was definitely a wake up call for him to start caring more about his health. Eating more nutritious food and working out are now priorities for him. His work life was affected moderately since he was able to work from home, but there were times that it was difficult to complete tasks remotely. He is fortunate to have a flexible job.
Once his health improved, if it did everything go back to quote unquote normal?
Shortly after recovering, he tried to get back to his routine, but he noticed that he would get tired faster than he used to before the virus. It was only for the first month that this happened after recovering from the virus that he felt this repercussion. Now he feels fine completely.
Was there an economic struggle that came with this diagnosis? For example, what is the cost of your family's COVID experience when you consider testing, medical bills, medication, and any time off of work?
We were fortunate to still be able to work from home and had savings in our account. Therefore, we didn't go through any economic struggle.
I know in the pre-interview you mentioned how the both of you were fans of traveling. Has the pandemic halted any travel plans, or do you plan to travel as normal during the upcoming holiday season?
Um, it definitely halted our plans to go to Greece this year. We had been longing to go for as long as I can remember. Hopefully, one day we'll be able to resume our plans. And as of now, we are not planning on traveling anytime soon. During the holidays, we'll stay home, definitely.
If you did or do plan to travel, can you describe any precautions you plan to take to avoid getting COVID again?
If we were to travel, we would, well, we always make sure that we are wearing a mask, wash our hands often, and carry hand sanitizer at all times. We tend to avoid crowded places as much as we can as well.
This next set of questions are focused on the impacts on your work life due to the pandemic. Can you give a short description of where you work and what your job involves?
As I mentioned before, I am a financial advisor for a trucking company. I am in charge of helping the company reach its financial goals by providing strategies to reduce costs and improve overall performance.
In your personal opinion, do you feel that your employer handled the pandemic appropriately? Of what could have improved?
The coworker that I think began the spread in the office had just been out for vacations at a hot spot in the US and wasn't wearing a mask. I feel that more strict measures should have been enforced. Quarantine should have been mandatory upon her return.
You shared that you had to work from home for some time due to positive cases at your workplace as well. How long did that last? How was that experience in particular?
Everyone in my office tested positive and had severe symptoms except for me. For that reason, I had to stand up for everyone and do their essential daily work for about a month until they fully recovered and were able to go back to the office. It was definitely a workload for me, but um, I carried on with the job successfully.
Since you are considered an essential worker, how did your workload change, if any?
Fortunately, my job is considered essential and the workload didn't decrease at all.
Did your family experience any economic hardship due to the pandemic?
Fortunately, no.
If you would not be considered an essential worker, do you think you would have stayed afloat?
If I would have lost my job in the process of this event, I would have just stayed afloat for only 6 months without working. My husband and I are financially conscious and we make plans to always have savings in case of emergencies.
Now I'm going to go over the final questions. Are you satisfied with the local response to COVID-19 in Edinburgh and Hidalgo County?
I believe that the stay at home orders have given many people a lot less motivation to go out, so to a certain extent, I'm satisfied.
Are you satisfied with the state response to COVID-19 led by Governor Abbott?
Governor Abbott has, in my opinion, did not give the valley the help it needed, although we were recognized as a COVID-19 hotspot. It truly diminishes the trust in our own government in moments of crisis.
Are you satisfied with the national response to COVID-19 led by President Trump and his administration?
President Trump and his administration have handled the pandemic disastrously. The lack of value he gave to science costed the US thousands of lives. Hopefully, with a new administration and a vaccine, the number of deaths and positive cases diminish.
If you had the power to respond to COVID-19, what would you do differently, if anything?
If I would have had the opportunity and power to respond to COVID 19 in the beginning of the year, I would have immediately locked down the country.
This is a special year in our national democracy because it's a presidential voting year. Did you vote? And if so, did you notice or do anything different because of COVID-19 pandemic?
I did not vote because I am not a citizen. However, I did notice a historic voter turnout.
Is there anything else you would like to share with me about your experiences with COVID-19 that I have not asked about?
I believe I have shared everything.
Thank you very much, Mrs. Cortes, for your time and for sharing your experiences. They are truly appreciated.
Thank you.